a rough day yesterday, but a very productive day. Just want to say a couple of things about yesterday as we proceed. Taj, we spent the day looking at a number of different issues as far as safe travel to schools by our children. And from my point of view, there were three things that stood out. I suspect you may have other things in mind. But from my point of view, there are three things, and I think we have a slide about those three things. One was the recurrent theme that safe infrastructure saves lives. It came up time and time and time again. And a sub-theme that safe infrastructure is not necessarily expensive. It was a recurrent theme going through all of yesterday. And then we had a bonus that safe infrastructure can come with wow. You know, water with wow? Well, infrastructure will bling. Adriana, was it Rebecca Tortella was it yesterday? We can have infrastructure with bling. We had a multicolored, oh, here, great. And the third thing that I want to highlight that happened yesterday is that we have a date in May 2018. Towards the end, the IADB gave a commitment. That commitment was reinforced last night when I wrote to the head, the regional director for the Caribbean and Latin America, that they will fund a pilot project whereby we can select using Julio's IRAP app to download and to look at a school and to change the school environment and the school zone from an at-risk, which is usually a one-star road or environment, to at least a minimum 3-star. We are going to meet next week Thursday to discuss this further. We are going to come up with at least 2 or 3 schools. And we are going to have implementation of that initiative next May when Avi and Company Limited will return. We'll have some fanfare with the government and the media present. And based on that experience, hopefully we'll launch into a full campaign of building out an organization together which can produce schools in Jamaica where children can go to school safely. And the final thing I want to, if I back up one slide, that came out yesterday, is that partnerships, both locally and internationally, is key. And that's what we're all about this morning. And that's what we're all about yesterday. Establishing partnerships, working together, moving ahead with urgency on a matter of national and international importance. So moving right into the program this morning, I shan't speak long. After I speak, then we're going to have Lisa Gay Green, who is the Senior Projects Manager, Mona Geoinformatics Institute. And we have the director here, Dr. Paris. We're not going to try and pronounce his name. Ayu Lee, well known both national and internationally. And then we're going to ask Abid to look at a very important issue. In fact, one of the most important issues facing our country as far as road safety is concerned, the whole question of global best practices for motorcycle safety. And then hopefully we won't have any drama, as we had yesterday, that Elaine Thompson will turn up and will deliver a speech. And as much as we'd like to hear from Bruce James, I would suggest that she's far prettier. And we'll welcome her much more than we welcome Bruce. It's nice to see Bruce, but there's good and there's better. So, as far as the Jamaica national safety situation is concerned, just want to make a couple of points. One is that from a policy perspective, we have moved from the National Road Safety Council being established as a creature of Parliament in 1993 as part of the WHO mandated lead agency policy. We have moved from there to creating a national road safety policy document, a document which needs revision. Then we lobbied for and were significantly involved in the implementation of what is popularly known as the drink and drive legislation and the safety devices legislation, both of which I would suggest need urgent review in terms of how we are implementing it. Although we had some data from SSP Allen yesterday, 54, if I remember correctly, positive tests in about 6,000 people were checked is woefully small compared to what obtains in other jurisdictions. And our people are still not putting on their seatbelt on the back seat. And they are still dying because when you have a crash, people are projected forward. So those two bits of legislation need some strengthening. Unknown to many, we then worked with a Swedish Overseas Development Agency, SIDA, to strengthen the data collecting and analysis capacity of the road safety units of the Ministry of Transport and Works. I'm sure Francine did know this long before her time. It was a direct policy of the National Road Safety Council, and Mrs. Fletcher was very involved in this. In fact, she went to Sweden and was trained further as a road safety advocate and implementation person. The next big thing as far as policy was concerned was that we established a below 300 target in 2009. And not just established our targets. We had a structure in place with support from the Prime Minister promoting interministerial collaboration, which is why we have evolved and continue to evolve and continue to make an impact on road safety. There are two things as I close, which we are engaging on now. One is at the cusp of being delivered as a research project. Natalie, we're glad to hear that we have signed off with, not paid yet, co-funded between the Government of Jamaica and FIA Foundation, a research project with Johns Hopkins University, Professor Andrea Gillen, and that is going to run from January this year, 2018 until 2019. A very comprehensive research project. This is a well-established and world-famous university which is doing tremendous work across the world. And they are going to be coming here, interviewing a number of you and doing the kind of research which is critical to any road safety organization. And that report will be available both nationally and internationally. I think it's going to be a landmark research project. In the same way, there was a landmark research project which started the National Road Safety Council in 1993. So we are excited about that, and that is something that we are looking forward. And finally, we have been negotiating for some time now, and we hope to conclude it next year, to establish a road safety unit at the University of the West Indies, Road Safety Institute, whereby we can collaborate with the various departments of the university to institutionalize the National Road Safety Council and its work. It's one thing for us to be doing this kind of work in this kind of context, but we need to lay the groundwork that it will last in perpetuity and have the support of the state. So that's our current situation as far as the National Road Safety Council is concerned. And with those few words, let me invite Lisa Gay Green, Senior Project Manager of the Mono Geoinformatics Institute, to share with us some data on the road safety situation.
Good morning, everyone. And to our visitors, welcome to Jamaica. For those who do not know, the Mona Geoinformatics Institute is located at the University of the West Indies. And simply put, we are a company that focuses on the collection of data and the spatial analysis of this data, essentially answering the question of where. Where are things located? How are they distributed? And so we have been, over the years, mapping crashes, and we have, in fact, partnered with Jamaica National General Insurance Company and the GN Foundation back in 2012, our first comprehensive study looking at fatal and non-fatal crashes, where we looked at how the crashes are distributed across Jamaica. We have also partnered with the JN Group as well to create the online fatal crash map, which allows stakeholders and the public to have access to crash data, to have an idea as to how crashes are distributed across the country. And so today, I am told I have 10 minutes. I will be briefly going through the 2017 data. That's the fatal crash data that we have mapped so far. So here you have the online fatal crash map that I mentioned earlier. All the red dots represent, each red dot represents a crash that occurred in 2017. We have been mapping crashes, fatal crashes from 2015, 2016, and 2017. So this forum focuses on child safety and health, and such. We looked at the distribution of crashes in relation to schools. And so we saw that in comparing 2016 and 2017, we saw that in 2017, there was a slight increase of the number of crashes that occurred within 100 meters of a school. We also saw that if you extended that boundary further to 500 meters, for 2016 and 2017, about 28% of the crashes occurred around these schools at 500 meters. And extending it even further to 1 kilometer, we saw that about 52.5% of fatal crashes occurred around schools. So having mapped the locations of crashes, we can, of course, identify which roads had the most crashes. And so again, comparing last year to this year, we saw that the roads in red represent those roads that were consistent between both years. These are the roads that had most crashes. So we're seeing that the highway in the vicinity of Green Island, Little London, and Runaway Bay was also, in 2017, seeing a lot of crashes, or having a lot of crashes. There were some new ones. We're seeing Brunswick and Jericho Road in Hanover not appearing so much in 2017. And of course, we have 2 new ones for 2017. Also, we can look at crashes based on administrative boundaries, in this case, communities. So we're able to identify which areas had the most crashes. And again, you can see that there are some communities that are still considered to have many crashes comparing 2016 and 2017. These are Negril, Little London, and Old Harbour. There are some new ones popping up as well for 2017. So just to give you some perspective, this is the parish of Westmoreland, the area in red, Little London, one of the areas that was highlighted before as having many crashes. In St. Catherine, we've identified Old Harbour, the community of Old Harbour, as having lots of crashes. Also, the North Coast Highway in the vicinity of Green Island. The North Coast is a very long stretch of road, but we've identified that there are certain segments of that roadway that are having lots of crashes. One of those is the area in the vicinity of Green Island, and the other one would have been in the vicinity of Runaway Bay. So when you looked at the deceased category, the persons who are dying in these fatal crashes, we saw that top in the list, we had motorcyclists and pillion riders top in the list there. Followed closely behind, we have pedestrians and private motor car drivers and passengers. And thereafter, we have pedal cyclists, public passenger vehicles, and the commercial motor cars. So just to know that based on our study that we did in 2012, we identified that only, and I repeat, only 3% of crashes were fatal. So the data I'm showing you here represents only 3%, potentially 3% of all the crashes. So it does not include the fender benders, the persons who may have been hospitalized but did not die. So it is important, I use this medium at this point to stress the importance of providing non-fatal crash data and analyzing that data as well to create a truer picture of the crash situation in Jamaica. And we also looked at the causes of crashes. And we realized that negligence and lane violation, based on reports we received from the JCF Traffic Division, we recognize that negligence, and these represent persons who may have alighted or opened vehicles without due care, persons who may have for lane violation, determined to overtake but did not take necessary precautions to look that the area was clear, and so forth. So you can see from the diagram here, the breakdown, pedestrians came in third, followed by speeding. And I think my 10 minutes might be up by now, but I will end by saying simply that Monash Informatics Institute are advocates, or we encourage or endorse evidence-based decision-making, and as such, we stand ready to provide assistance in any way we can in providing data for informing the policy changes that you will discuss in your forum. Thank you.
Thank you very much, Lisa. I'm now going to invite Francine White, who is the statistician of the Road Safety Unit, Minister of Transport and Mining, to share the data from a slightly different perspective.
Good morning, everyone. All right. So as introduced, my name is Francine White, and I'm in the Road Safety Unit of the Ministry of Transport and Mining. I think I met him. So what I'm going to be focused on in my little 10 minutes is the cross-year comparison of crashes for the last 5 years. Okay. So basically, I want to give you a total picture of what is taking place. And I've also included the fatal accidents as well as the fatalities. If we look at 2017, we see that there's a great reduction in fatalities. However, we're not seeing that much of a great reduction in fatal crashes. And we're also seeing that though this is what I want to look at. You're hearing me? Sorry. This is what I want to look at. Though we are putting in policies to try and affect fatalities, we're not seeing that much of a great reduction in the number of crashes. We want to look at it for categories across year. We've seen that pedestrians have been relatively steady, ranging from 97 being the highest to 80 being the lowest. With motorcyclists over the past 3 years have overtaken pedestrian, and they are now our highest fatal category over the 5 years. We're also seeing, gladly, that this year there has been a decrease in PMC passengers, and there's well, not so much of an increase, but it's kind of been fluctuating for PMC drivers. And we are seeing that because what we have been doing at the Road Safety Unit, we've been putting out a lot of information, trying to get persons to buckle up, trying to get persons to take care of their own safety, whether they're in the front of the car or in the back of the car. So we're trying to push that message, and we're seeing where there is some impact based on the data this year on what is taking place. All right, so I've also done a map so you can see a side-by-side comparison of each year with regards to fatalities. We've seen that as explained by the data, motorcyclists and pedestrians are the top category, followed by the PMC passengers and the PMC drivers. We want to look at child fatalities over the past 5 years, and right now we're seeing there has been so much of a fluctuation, and this data is up to yesterday, by the way. We're seeing that there's so much of a fluctuation. I mean, this year, followed by, from 2015, which up to yesterday we had 12, and up to today we have 18. Yesterday we have 18. But there has been so much of a fluctuation in child fatalities, and I also want to point to the fact that child fatalities, what category they are dying in? They're dying mainly in pedestrians, which means that drivers are hitting them down. That's the category they're mostly being killed in, children. We want to also take a look at another category of our road user that we consider that needs a lot of help and a lot of protection, the elderly. We're seeing where, again, this year, we have seen a little bit of a reduction, but it's mainly a fluctuation across the 5 years, in both in fatalities and fatal crashes. We're also seeing, again, that drivers are hitting down our elderlies, because that is the category that they're dying in, mainly. Okay, so we want to just look again at our motorcyclists in depth. Our motorcyclists in depth, we're seeing that whenever we start the year, we seem to start off with a bang when it comes to motorcyclists. In January, they seem to just they get out the gate and they continue. They start off with a high figure in January. It's usually and then many of the initiatives starts to come out and they reduce a little bit, reach right down to summer, July, and they peak again, and then they reduce back down closer to Christmas. And we see that as a trend over the 5 years, both in fatalities and fatal accidents. Pedestrian. Now, we have seen pedestrian have somewhat increased and decreased over the past 5 years. But this year, they were on an upward trend this year, and they sort of level off around August, where they start to reduce pedestrian. However, they still hold the second spot for the past 3 years of highest category in fatalities. All right, so based on all of this data, the Road Safety Unit have done a sort of a projection. As you're seeing, currently we're at 303. But after all the data is collated, we are estimated we'll be around 340 around that for the end of the year. We're hoping not. However, that's what the data is showing us based on past trends. Let us hope it doesn't happen, but that is what we are seeing. And as you've seen, we've projected per quarter. And when you see the A, that's actual figures for the first quarter, second quarter, and third quarter of this year. We are estimated, but we hope not. It's just an estimation but we are not going to go beyond 342. All right, and thank you very much. This concludes my presentation.
Thank you very much, Francine. What the data is showing is that as of today, 304 people have died on our roads. Today is the 15th day of December. We have 16 days to go. If 37 people die in 16 days, that's a national disaster. No, man, I'm good. No. Yes, but I'm only saying that if 37 people die in 16 days, that's a national disaster. So we are praying. And we are not only praying, but we are instructing the police to ensure that the protection from the road safety unit does not come true. Thank you very much, Dr. Francine. That was very good, the data sharing.
Just add, the mathematician just worked out that if we maintain the 17% to date that we're experiencing now,
yeah,
and we apply that to last year's figure, it would be 300.
But 300 gone already?
It would be, right, 300 gone already. So therefore, we're going to be below. We're only 303, we are 303, so we're not going to make it. We are declaring that.
If you're a Pentecostal, you say, speak it into being. Avi Silverman is the Deputy Director for the FIA Foundation.
Dr. Jones, is there any value in reporting the number of crashes?
We're going to come to discussion in
Okay.
Yeah. Avi Silverman, as I was saying, is the Deputy Director for the FIA Foundation. He has traveled the world preaching the gospel of road safety, and more than that, implementing and meeting officials at the highest level. This is the reason between Avi and his boss, Saul, and others, why, part of the reason, not the entire reason, why the UN, along with other countries, well, sorry, the United Nations in 2010 started the decade of action for road safety. This man here, Avi Silverman, and this organization, the FIA Foundation, has played a pivotal role in what is now an international campaign. It is a great privilege to welcome Avi to share with us best practices on motorcycle safety.
Thanks for that kind introduction, Lucian. It's very sobering to see the statistics. Obviously, we all hope that it's not going to be as high as that. And you, I know in Jamaica, you often want to beat the clock. You want to beat the time. You want to get the data down. So I hope you're able to do that. And if not this year, obviously, to push on and make further progress as we continue. I'm going to talk about some global best practice in motorcycle safety. Often it can seem that, as with other categories of vulnerable road users, of which globally motorcyclists are counted as a vulnerable road user along with pedestrians and pedal cyclists, that it can seem as though it's difficult to address this issue. There are many, there seem to be an endless number of issues to address with motorcyclists to improve the level of safety. But there is some global best practice out there that's been put together that provides, at the very least, a very useful framework, and also provides some focus on the kinds of interventions that do produce a reduction in fatalities and injuries, which, as we've just heard, is what we all want. So I'm going to give you an overview that's been put together, a combination of the World Health Organization on motorcycle safety and the OECD. The OECD set up a working group on motorcycle safety in 2010, and it produced a report in 2015, and it's still focusing on this issue as well, doing research into motorcycle safety, which is ongoing. But there's plenty of good structure and good focus in the OECD motorcycle safety report. And if you're going to focus on motorcycle safety, here I'd recommend both looking at the report and engaging with the OECD working group. This is the global context on motorcycle safety. They account for a disproportionate fatality burden. So whereas globally they are 8% of the motorised fleet, they're 17% of total fatalities. And globally they're 23% of the burden of fatalities worldwide. And that combines, this infographic here combines all vulnerable road users, and it's very similar to the Jamaican picture. You know, your motorcycle fatalities and your pedestrian fatalities are quite similar in terms of the proportion of your total. You've got 29% of your total is motorcycle fatalities this year, and 23% is pedestrians, and that number goes up and down according to different factors in many places. In some low and middle income countries, particularly obviously where you've got much higher prevalence of a motorcycle fleet as well, you can get 70% of the fatalities being motorcycle fatalities. The worrying thing for Jamaica, I know as well, is that your motorcycle fatalities appear to be on the increase as well. And in many even developed countries, you see that there's an increase in motorcycle fatalities against a backdrop of overall decrease in fatalities, which can be an issue, which kind of highlights that there need to be some special measures taken for motorcycles. The global best practice on it is really this, that as with everything else, the safe system approach still applies to motorcycles. The safe system approach should guide the overall road safety strategy, and the safe system approach in particular has key elements of it that I'll come to in a minute that can result in a reduction in fatalities and injuries for motorcyclists. A multi-stakeholder approach to share responsibility for motorcycles is needed. It should be an explicit part of a national road safety and transportation strategy. This is because there are some aspects of motorcycle riding that are specific to motorcyclists. There's some vulnerabilities. Motorcyclists are going to be more vulnerable on the road, more vulnerable to skidding. Balance is an issue on motorcycles. They're going to be more vulnerable to speed and to alcohol, even more so than other road users. It needs to be a particular focus in a transportation strategy. Promoting appropriate behaviour, training, licensing, speed and alcohol enforcement is important. I'll come on to that in a minute. And in many places where specific training and enforcement regimes have been in place, there's been a corresponding reduction in fatalities and injuries, but also along with infrastructure and vehicle safety. The vehicle safety side of it, unfortunately, well, I don't know whether it's unfortunate or not, but the situation is that ABS is a fundamental motorcycle safety technology that has been proven to reduce fatalities and injuries. Now, the situation is that I know that in many fast emerging economies, you're not going to get that high proportion of the motorcycle fleet with ABS already on it. But there are other things that can be done. Actually, much simpler technology has also been quite effective. Having legislation enforcement on headlights during daytime has been shown to reduce fatal crashes by up to 10 to 15% in some countries as well. This is because of the specific visibility situation of seeing motorcyclists, which is important. And helmets is probably the single most important aspect as well of motorcycle safety, which I'll come to in a minute. So the safe system approach on motorcycle safety is, as I described it yesterday, it's the same approach really. That mistakes and inappropriate decisions will occur, and it's particularly acute on motorcycles. They have a vulnerability about them. There's no two ways about it. Can't do anything about that. They are vulnerable methods of transport, and mistakes will occur. The system, the policy coordination, needs to minimize the frequency of errors and needs to protect motorcyclists from death and serious injury when these errors inevitably occur. And that is the guiding principle. It's a very good example from Sweden, which pioneered the safe system approach in general and has pioneered the safe system approach particularly for motorcycle safety. And what Sweden has done is looked at the various different measures within this safe system approach that could be implemented and run a test of effectiveness and cost of whether they should focus on one measure or another. And they've picked essentially about 3 measures to really focus on, and that's resulted in a reduction of fatality and injury. They actually focused on anti-lock braking systems. They focused on speed limit enforcement in particular, which I think was the single biggest contributor to motorcycle reduction in fatalities in Sweden, and focused on safe intersections. And they did their road assessment, and I don't know, maybe Julio in a minute can talk about this, can confirm this. Looking at intersection safety for motorcycles is key, that you can do analysis to show where your crashes are occurring, and most of the time finding that it's the intersections which is where crashes are occurring. I'll talk about that in a minute when I get onto infrastructure safety. But addressing that in Sweden, those areas led to a 50% reduction in fatalities and injuries for motorcycle riders, and had been very, very effective. The global best practice on addressing behaviour, looking at the systems and processes to address behaviour. It's not just a case of running some education for motorcyclists. It's looking at the processes that need to be in place from the licensing system. This is a particularly effective way of doing it, taking a graduated approach to motorcycle licensing and starting off novice motorcyclists on a particular regime of licensing to manage them, ensuring that they gradually build up the skills, knowledge and expertise to be able to cope with their, to ride safely. A lot of countries have adopted graduated licensing schemes, starting, for example, off on a restricted license to a provisional, to a probationary, to a full, and running training programs alongside that. And when they've done that, they've had very good outcomes from all of that. On the training side of it as well, it was interesting to hear yesterday of your Back to Basics community road safety initiatives with younger groups and communities, and this is obviously, I know you're doing it on motorcyclists as well. I mean, this is obviously a very effective type of approach, and can easily have the global best practice strengthen it and feed into it. I know that in the region in Belize, they did some very effective youth engagement that also included motorcyclists, and has overall resulted in a reduction in fatality, with our partner, the Youth for Road Safety organisation, working there very effectively. So there's plenty of examples, some quite close to home, some of which you've already started, which is good. And combining that with enforcement, intensive, visible enforcement campaigning alongside the engagement with communities is a key element of the best practice. Moving on to vehicle safety in particular, I mean, as I say, ABS is the technology that is very, very effective, but this has many issues, I know, in low and middle income countries, of high cost and penetration, but some of the elements, such as the headlight safety, ensuring that headlights are on. I know you can also get technology, automatic headlight on technology as well. Often you're not going to get that across the vehicle fleet, but legislation and enforcement on headlights is an effective approach as well. And then helmets is the real element that really does reduce injuries and fatalities, which I'll come on to in a minute. In terms of the road infrastructure, the principle applies that if you have roads that are designed with motorcyclists in mind, they do benefit, obviously, all road users. So it's not as if you're just having to do one and not the other. You're doing both at the same time. This concept of self-explaining roads with signage, with road markings, with clear identified speed limitations and enforcement around that is, in most countries, the way that has proved to be very effective, guiding riders to appropriate behaviour. Removal of roadside obstacles, as Julio, I'm sure, will emphasise, is absolutely fundamental for motorcyclist safety as well. If a motorcyclist comes off the road particular areas that are going to be designated as black spots or assessed in the IRAP methodology as areas that are going to be 1 or 2 star roads. Motorcyclists come off and there's obstacles by the road and the motorcyclist hits the obstacle. We're obviously going to be talking about probably serious injury at best and fatality as the most likely situation. So there are guidelines on obstacles and how close they should be to the roadside, particularly for areas where motorcyclists are going to be at speed and prevalent. In many countries, separated motorcycle lanes has been the best approach, but I mean, this can be obviously very difficult to do where you've already got your infrastructure. But I mean, I suppose what it highlights is that the principle is that where you have the mix of traffic at speed, you've got higher risk, and where you mitigate against that, where you stop the traffic mixing and you separate out motorcyclists, you're obviously going to have a large impact in terms of reducing fatality. So there may be areas where that can be done, although it's unlikely you're going to be able to do that in many places. This is another example of the specifics of motorcycle safety. You know, the skid-resistant materials that are used in road markings, very important for motorcyclists, and the converse applies. Where you're not doing any of that, you're going to have greater level of risk all over for motorcyclists. Intersection modification is very, very important, and there's a lot of good research out in the OECD Motorcycle Working Group into that, and the IRAP has done as well, showing that, you know, a simple solution of installing a roundabout can have a huge reduction in motorcycle crashes, and particularly where you have speed management motorcycles coming into a roundabout, and an effective enforcement of that. It's much, much safer for motorcyclists than just an intersection. Yeah, roundabouts reduce motorcycle injury by half in Sweden, where they implemented them effectively. So that brings me on to helmets, which is absolutely fundamental. I mean, you probably know the stats around helmets. Proper helmets reduce the risk of death for motorcyclists by 42%, reduce the risk of serious injury by 69%. That's global, that's the globally accepted figures. There's obviously some key aspects of that. I mean, to start up there on the right-hand side, there's a global target now for all. It's a voluntary global target that's just been agreed as of last month by the World Health Organization and international governments to aim towards, by 2030, to increase the proportion of motorcycle riders correctly using standard helmets to close to 100%. And that is, you know, a bold target, but one in which, you know, it's just simply the case that motorcyclists should be wearing safe helmets. And there are countries where that has been effectively implemented. The helmet approach is that there needs to be helmet legislation issued and really enforced in a sustained, substantive way with a proper enforcement program behind it and a campaign behind it. There needs to be a lot of work done to fight against the proliferation of fake helmets. Affordability is a key issue, and I know that out there are the global standard, which is set by the UN Economic Commission for Europe for a full face helmet, but this may not actually be so optimal. This is what the OECD working group says. It's not me saying this, it's the OECD saying that, you know, in many places, particularly where there's climate, there's heat, you know, you're less likely to get the high proportion of the motorcycle population wearing the full standardized helmet. We may all like to get there, but pragmatically it's not going to happen, that there needs to be some kind of compromise made, and a national standard which reflects that can mean that you get a high proportion of the population wearing a safe helmet, but not necessarily one that conforms to the full UN ECE standard. And this is what happened in Vietnam. They issued a standard for what's kind of commonly known as the tropical helmet, lightweight helmet, that's just as safe as a full faced, heavy UN ECE standard helmet, but is much lighter, easier for people to wear, and still has very good results in terms of protection in a crash. And that's one of the main areas they worked on, and together with enforcement, legislation and campaigning, and having an appropriate helmet standard for their own context, they ended up with very significant reductions in injuries and fatalities with their campaign. I mean, on the bottom right-hand side, they achieved, even in the first year, a 90% increase in helmet wearing rates, with enforcement, with campaigning, with the helmet standard that they had. And that corresponded to a 24% decrease in traffic crash injuries, in serious injuries, and a 12% decrease in fatalities as well, just in the first year. And that was something that was sustained over a period of several years as well, with follow-up campaigning and enforcement. The situation at the moment in Vietnam is that there's still work to do on the standard. When they do their surveys into how many people are wearing proper standard helmets, you know, it's not necessarily the case that 100% are wearing. In fact, it's more like half in the surveys are wearing the standard helmet, but they're working very closely across government with the Bureau of Standards in Vietnam to ensure that they can fine-tune it and get the rate of standard helmet use increased in the country. It's a very good example of helmet campaigning, and I would recommend, there's a report that was just out yesterday in Hanoi in Vietnam by the coalition that have implemented the helmet program, assessing the 10 years of helmet campaigning that they've done in Vietnam and the effectiveness of it. And that report is available. I can, if you're interested in it, I can show you where you can get it, and it details all of that. And alongside that, in Vietnam, there was some very effective campaigns that were done. As I was saying, on the right-hand side, you can see that the campaign they did with a young motorcycle rider that's saying that he won't wear a helmet because it makes him look stupid, and there he is with a horrific head injury that he's suffered, having to be looked after and receive medical treatment for his injuries. That, I think, really wraps it up effectively. The other thing I should say is that over the 10 years in Vietnam, they've estimated to have saved 20,000 lives and prevented 412,000 serious injuries and saved $2.6 billion US. So obviously, it's an effective campaign that they've done out there. Thank you very much.
Based on Avi's sharing about global best practices, you understand now why I was suggesting yesterday that he should get a unique Jamaican identifying number. But I go further and say he should be given some kind of United Nations award for the kind of work that he and his organization is doing across the world. Tremendous tour de force of what we can do to reduce motorcycle injuries and deaths. The helmet use, the ABS, automatic headlights, we can do this. We can do this. And the kind of numbers that he cited at the end, which has benefited the Vietnamese country, the amount of money saved, the amount of lives saved, we can do this. And we need to do this in Jamaica because motorcycle injuries now is our #1 problem, and Tarek is going to speak about this, I'm sure, when it comes to the roundtable discussion. So, we have a big moment in the workshop. I was very privileged to be at the stadium when Asafa ran his first sub-10 100 meters. And he promised the nation that they're going to have something special, that he was going to exhibit what he called the power running. And of course, Asafa was the first of the world famous and greats coming out of equally world famous now MVP group headed by one Bruce James. Then we had the Pocket Rocket, who I think pot cover is what best describes how we feel about Shelly-Ann. I can remember what is now known as Beijing, half a tree. Everybody had a pot cover when Shelly-Ann won her first and second gold medal at the Olympics. Then last year, 2 years ago, in Rio, Brazil, the country erupted with joy when one Elaine Sandra Lee Thompson won her first Olympic gold medal. And if that joy was special, when she won the 200 meters, becoming the first Jamaican woman to win both the 100 and the 200 at any Olympics, then the country exploded and was ecstatic. The only thing that was left for us to declare a national holiday. But there was no PJ Patterson to do that again. That's my country. We have the great privilege, ladies and gentlemen, to welcome into our midst and to issue a call for action, the one and only Elaine Sandra Lee Thompson.
Good morning, everyone. As you know, I'm Elaine Thompson, and before I actually speak on Child Health Initiative, I can give you a small story back when I was going into my primary school in the small Cool Hills, Manchester Banana Ground. I didn't have any taxi and any bus going to school, so I have to walk like, I would say, 3 miles, if it's a lot, 3 miles to school. And my primary school is not a well-known primary school. It's Garlogie Primary and Junior High. It's not Garlogie Primary. And normally we don't have any pedestrian signs nor any, I would say, sidewalk. So if cars coming or any vehicles coming, you have to listen keenly and turn and go in the banking because it's not a sidewalk, but we just call it bush or banking. So now a lot of kids have a lot of privilege. They have pedestrian, they have banking that they can walk on. So I'm just here to give a little speech, less than 10 minutes, to speak on our children's health. So the first thing I would say to the motorists, please slow down, look, listen, and give way. Always be mindful of children when driving on the road. Children may not be vigilant, but we have to be vigilant for them. Examples for them is like following safety rules. We can also teach them the signs, because some of them don't even look at the sign. It's a crossing, they don't look at the sign. So you have to teach them the sign that they can use the sign. And us as example, have to set the example, because as they say, children live what they learn. So if you don't do it, they don't follow. And every child has a right to explore in the world, safety. We must encourage safe walking, cycling, outdoor play, and exercises. pay attention, listen. Do not run on the roads because sometimes, school is over. We can't wait to hear the bell. When the bell rings, we just dash and run home. So sometimes you have to just pay attention, especially watch the time. If it's school time where, it's school is over, you have to just watch the time because, sometimes the kids don't want to just run home. So you have to just watch the time. Always do the sidewalks. Crossroad and pedestrian crossing. Never stick hands outside the vehicle. Never cross road at bends. Avoid strangers, playing in the street, cell phone use on the road, and traveling in bad weather. I know since the last couple of months, a lot of rain is falling, and I've been driving back and forth to training. And sometimes when I head home, I see the kids on the sidewalk, and I have to take my time, drive to the water. I don't want to drive fast and splash them. Because I remember when I was walking, sometimes I get a lot of splashes, but I have to just turn it around and flip it, say, okay, and I take my time and drive through the waters because I know they don't want to get wet to go to school. They have to stay dry. And I realize a lot of kids are also using earphones in their ears while they're walking. And I'm saying that how they hear when the car is coming and, sometimes they're beeping, but they don't hear well. So I like to just take a lot of protection for them, like a lot seize earphone, cell phone, because I know some kids just walking into the cell phone. How can you see where you're going? They don't listen, they don't look. And the first safety rule I learned I was in primary, look left, look right, look left again. I don't see enough of them doing that. They just cross. Sometimes they take their whole little time crossing. It's like they do it for purpose, but sometimes I have to just be mindful and careful. Okay, they're just kids. Just give them the time. They will grow and understand. And also, the speed limit is also one. I know sometimes we really want to press gas and drive fast, but the highways out there, you can go out there and press gas and drive fast. But you can look out, when you're in a school zone, you can't really want to drive fast because you have to look out for the kids. I remember when I was in Banner Ground, we didn't have any play field, so we have to play ball on the road. It wasn't safe, but we want to play, so we have to just watch out for the cars when they're coming. As long as you hear a car, we just grab the ball and just run to the side. So sometimes we have to just look out for the kids because even though we have small communities, not every community have playground or a little grass we can play on. Sometimes we have to just do it on the street. So we have to just look out for the kids sometimes. We as the leaders, we are the leaders. So sometimes the kids won't be the leaders. We have to lead them. Because I remember, as I said, growing back down in country, we didn't have any play field, so sometimes we just be the leaders, as we said, children live what they learn. So if we be the bigger one and do all the safety stuff and the road codes, I think they would follow. Sometimes, I don't say sometimes driving past and tell them what to do, because it's not every child wants you to just stop and just tell them something, because some of them so face them with it. You're not my mom, you're not my dad, so so sometimes we just allow them to grow, because I remember I was that child once, so just allow them to grow and just take a lot of care for them. And as I'm wrapping up now, it's not long, so please slow down. This will make the road safe for us, and our children are better able to be defensive drivers at slower speed. We'll have more time to stop. Vision will be better. We'll have more time to react in the event something should happen. Please slow down. And one more point. As I was sitting there, I saw a list of the persons that are killed this year, and it's 303, right? And honestly, I wish that could reduce probably to 0, if that's possible. Because comparing this year and last year, this year is a little bit less, but it's still a lot. 303 is a lot. Last year was 359, right? So I wish that could just break down year by year and not rise higher and higher. We just have to be careful, drive safe, and look out for the kids especially, our children especially, because sometimes their mind is not really here. I know their mind is all over, thinking about a lot of things, so we have to just be careful and just look out for them and just ensure that they have a safe health, a safe education, because if they don't go to school, they can't learn and be Elaine or a police officer or a nurse. So we have to just look out for them and make sure that their health and their safety is up to par. And they say the children is our future, so we have to just take it slow and just look out for them. Thanks.
When Elaine won the 200 meters in Rio, there was a Daphne Skippers right behind her, trying to catch her. Couldn't catch her. This morning, many would like to be able to achieve and to speak from the heart, as Elaine did. And she gave a very touching speech. And we thank her so much. And this is going to resonate so much across the nation and internationally, as captured on tape and otherwise. So I'm going to invite Avi and Rebecca to take some pictures before we continue with Elaine. Well, after all that excitement, we are going to move right along with our program. The next presenter will be Natalie Drayson, Director of the North American Office and United Nations Rep for the FIA Foundation. Natalie has been trained, did training and studied at the world-famous Johns Hopkins University, which I just mentioned. And she's going to share with us some lessons learned from Johns Hopkins University. Natalie?
Thank you so much, Lucien. You should really come to Hopkins. It would be amazing to have you teach there. I would take your class. So it's really an honor today to present on behalf of Hopkins and on behalf of Andrea Gielen, who's the director of the Center for Injury Research and Policy. Andrea was actually a professor of mine, so I'll be presenting some of the material that she taught me, which is kind of funny. And I owe my passion and really my career to the center. It really it translated directly into what I do today. So Andrea and I really want to thank you for the invitation to speak. And as you know, Lucien mentioned this before, Hopkins is producing a gap analysis and recommendations for programming and for policy and for research to reduce road traffic crashes for the National Road Safety Council. So we thought it would be good to kind of familiarize ourselves today with the center's work and to draw on some lessons learned. I'll be talking mostly about child passenger safety, though our focus here in Jamaica obviously goes far beyond that. There's some takeaways that I think we could learn from as we move forward. So again, just to clarify, I'm a Hopkins alum. I'm with the FIA Foundation, but Andrea trusted me to present her slides today, so I hope to do justice to her good work. Do we have a clicker by chance so I could advance the slides? If not, I can just tell you in the back, next slide. Yeah? Oh, we do, somewhere. Let's see. Is there a clicker for the slides? Oh, Lucien. Okay, thank you. And it works, great. So first, just to introduce you a little bit to the center, it's one of 10 centers of excellence funded by the United States Centers for Disease Control and Prevention. And it was funded in 1987 and has about 20 faculty members, and you can see its mission here. So let's just start with a success story. We talked about this a little bit yesterday, right? Motor vehicle crashes in the US and fatalities are going up. But before that happened, they went down. And that was actually declared by the CDC as one of the greatest public health achievements of the 20th century. And you can see this graph actually shows us why. So from about 1925 to the mid-1990s, vehicle miles traveled, which is the green line, increased dramatically in the US. And at the same time, deaths per million vehicle miles traveled actually went down by about 90%, which is a major public health accomplishment. And so how did that happen, right? And how can we learn from that here? So there are a lot of reasons behind this success story, including the fact that roadways and motor vehicle safety standards were very much improved, and laws were passed to mandate the use of seatbelts and car seats and to prevent drinking and driving. And these are things that we talked about yesterday, which are going to be part of your national laws, right? And some of them already are. And it's not just about changing individual behavior, but also environment. And in most of our public health successes, this is how they occur, right? It's both environments and behaviors changing to protect and to promote the public's health. So in injury prevention, though, this notion was a bit slow in coming, and that's because people couldn't agree on which was better, as you can see from this quote from a CDC leader back in 1984. And the basic premise is that we can't just choose between education versus engineering. I think we are all on board with this. They're not mutually exclusive. And a very good example that I like to give is fluoridating water versus teaching families to brush their teeth. You have to do both, right? You can't just do one. So today we know that we still have to do engineering and education for future successes in reducing road traffic injuries and fatalities. It goes back to this. So I'll move on to some examples from the center's experiences over the years that illustrate ways in which we use multiple strategies to address child passenger safety. And again, here we're talking about a wider scope, but we can learn from success stories in these other areas. And it's great for you to become familiar with Hopkins, as I know they will be interviewing you very early next year. So let's start with the state of Maryland, which is just outside of Washington, D.C., and from the city of Baltimore, where our center is located and where I lived for 6 years. And as I mentioned yesterday, parts of Baltimore actually remind me a lot of parts of Kingston, Trenchtown, Tivoli Gardens, that kind of area. And although this lovely picture of our inner harbor might not make you think that, there are definitely parts of Baltimore where children can see the inner harbor but have never actually been there. And so there are extremely poor areas with health rates of HIV, for example, that are past parts of sub-Saharan Africa. There's parts of Baltimore that are very much in need of help. Anyway, apart from the fact that Baltimore could learn kind of from what we're doing here in Jamaica, frankly, let's talk a little bit about child passenger safety. These efforts began late in the 1970s, and they were greatly influenced by Sue Baker, who's kind of the mother of injury prevention, and she's a personal idol of mine as well. She showed that infants had a significantly higher rate of death from motor vehicle crashes than any other age group. And this stimulated the passage of child restraint laws, educational programs, and standards for car seats around the US. And here we have a picture of Andrea's son in one of the early car seat models that was distributed through the state health department program. I have to admit, I remember being in a car seat that looked a lot like this, right, with the thing that like came over your head, almost like you're on a roller coaster and went into your lap. And I would sit there for hours as my parents would try and drive me around, getting me to fall asleep. I don't know if any of you have done that with your children, but that's how my parents got me to fall asleep. I was difficult. Anyway, here's how the center addressed child passenger safety in Maryland State Health Department. It's the same theme that we started with, right? Changing environments and changing individual behavior. And the center actually came up with the very first child passenger safety program using the strategies that you see here, working to pass legislation, establish car seat loaner programs, working with law enforcement and healthcare providers, and creating public information and parent education programs. And that all sounds fairly simple, but actually it took quite a lot of planning because, as you know, failing to plan is very much planning to fail. So I'll briefly show you the planning model that the center used because it's held up over the decades, and I think there's parallels that we can draw for our work here in Jamaica. And this is the planning tool. It's called the Precede Proceed Planning Framework. Don't get too distracted by all the different boxes. I remember Andrea presented this in class, and I was like, oh my God, where do I begin? Okay, so I'll walk you through it. It's a structured way to build behavior change programs that focus on both the individual and the environmental changes that we need for population impact. And in this specific example, the overall goal, right, is to achieve the health outcome that's all the way on the right, to reduce child occupant injuries and deaths. And the model has us doing this by increasing the use of car seats through education and legislation. And the way we get there starts on the left-hand side, which is working with communities, legislators, and healthcare providers. But the magic of this happens really in the middle. It's the predisposing, reinforcing, and enabling factors. And in this case, these describe, one, what parents need to know to believe and to be predisposed to take action. Two, who can influence or reinforce parents for taking action. And three, what resources and environmental changes are needed to enable parents to take action. So it's by identifying these predisposing, reinforcing, and enabling factors that you can plan and build effective program components. And when you look at what we're aiming to do here in Jamaica, these are the necessary ingredients in the recipe for success, and they're very much what we're doing. So, for example, to reduce road traffic crashes around schools, right? In speaking with parents and community members and teachers and police this week, we really saw for our own eyes the predisposing factors. We can see that there's awareness among all of us, right? But we need to raise it in the rest of the community, which still sees sometimes crashes as a normal part of life. And you'll notice, by the way, I'm using the word crashes and not accidents, because road traffic crashes are not accidents. They're entirely preventable. They're not an act of God. We can prevent them, hence crashes. And I can see all around town through your billboards and through your road safety curriculum in schools and all of your efforts with the police as well, that we're starting to make crashes not the norm. They're not accidents anymore. And another simple way we can address this predisposing factor is by what Amend does so well. And Jeffrey was talking about this, right? Ask kids to show us on a map where they feel unsafe, because they know. And this helps kids and parents and teachers to think about crashes and the journey to school in a way that recognizes that the danger on the roads is not normal. So educational materials are going to help us reinforce positive behavior, and it leads to the outcomes that we're looking for. And I saw a good example of this actually 2 weeks ago when I was in Senegal with Jeffrey, where we were implementing his SARSI project. And it doesn't just build road safety infrastructure, but it also incorporates education and teaching kids that the sidewalk isn't there to walk beside, but rather to walk on. And that education is a reinforcing factor, right? We heard the same thing from teachers here in Jamaica. You can't just build the crosswalk or the sidewalk. You have to teach kids to walk on it. And we heard from Julio from IRAP, and IRAP focuses on the enabling factors. It's collecting data to educate legislators about the need and to enable environmental changes that a program like SARSI can actually implement. So when we spoke to teachers at schools, we could see that naturally not all injuries are reported, right? We need to learn from not only where those injuries happen, but also analyze the safety of the road through tools like IRAP to prevent injuries before they occur. Jeffrey had a great quote yesterday. It was that you can be sure that the schools where we see minor injuries are the fatalities of tomorrow. And he's absolutely right. And that gets back to the enabling factors. So going back to our Hopkins example of child passenger safety, when these factors all come together, they mean success. And here's proof in black and white. I think they had color photography back then. I was not born. This is the governor signing our first child passenger safety law. And much like we see with the law here in Jamaica, it's really a group effort. And it worked, because by 1985, every state in the US had a child passenger safety law. And car seat use increased from about 65% in 1995 to well over 90% in most places that you see today. And the effects are really viral, and this is why it's so important that we're doing it here. We're working in Jamaica because we know that change here is possible. You have the political leadership, the wherewithal, and the connections to succeed. And I talked yesterday about Vision Zero for youth, right? And Elaine just talked about reaching zero and how that's what she wants to see. And it might seem ambitious, but we can at least start to get there with our youth population. And that goal of zero within the youth population is completely achievable here in Jamaica. So let's just fast forward here today, going back to the child passenger safety, and this is Andrea's grandson, who's the newest car seat model. The point I want to make here is that even though most kids ride in car seats, there's really high rates of incorrect use. How many of you have actually tried to install a car seat? Anyone? It's really hard, right? It takes a lot of training. And very often, yeah, it's like impossible. So often, I'm sure everybody actually we go around the room and tell our horror stories of installing car seats. Often the kid's in the wrong seat, or we install it incorrectly, or the parent uses the seat inconsistently. But also, how many of you have jaywalked, right? I grew up next to New York. Jaywalking is a sport, right? We would try not to get hit. We were like moving targets. It was great. How many of you walk around while looking at your phone? I do sometimes. It's really hard to be perfect. But one thing I actually love about road safety is that we have the capacity to anticipate really stupid mistakes and to prevent their detrimental or their fatal effects. And this goes back to the safe system approach that we've been talking about. Though the center does fantastic work in educating people about car seats, it's impossible to reach everyone, and humans are always going to make mistakes. So I added these 3 slides, these are my own slides, to show why it's important to combine education with engineering to correct for human error. These are from the Swedish transport people who started Vision Zero, and they show why the infrastructure changes that we've been talking about here, as you mentioned, it's a recurring theme, right, around schools are so important. And this is why we can't just rely on education. So educating people to wear brightly colored clothing and to walk on sidewalks and to use zebra crossings certainly helps, but it's not enough, because roads have to be forgiving of human error. And that's the safe system approach. So for example, this looks like a very nice, safe road, right? And there's a sidewalk, and there's a pedestrian crossing, and there's even a stoplight. And these road users look like they're probably fairly well educated. But what you really can't see is the wild card. it's the driver. And if the driver is speeding, you might as well be letting those people walk around on a tightrope. Because one time forgetting to look both ways, or to stop at the light, or to ignore your phone might really mean death. And as we know from watching kids cross the street, they're not perfect road users because they're children. And their movements are unpredictable, and they're playing, and they're talking with friends, and they're worrying about getting to school on time. And they're little. They can't sustain the same kind of impact that we can sustain. As we talked about, if you hit a kid at 30 kilometers an hour, that kid might survive. You hit that kid at 50 kilometers an hour, that kid is probably going to die. So infrastructure changes help catch the kids who've fallen through the cracks of education, or the kids who are just very simply being kids. They help reduce speeds, protecting not just car occupants, but also children who are just walking or children who are on motorcycles. And this is a slide that I will credit to Julio, and it shows why speed management is at the heart of what we do around the world. It's at the front lines of winning the battle against road traffic injuries. So you can see, right, we talked about education reduces stupid mistakes. That's all the way at your last line. Enforcement reduces deliberate errors. Infrastructure can reduce the collision speed. And vehicle impact, right, is another thing as well. But at the very front lines of defense is safe speeds. And that's why it's at the heart of the safe system approach. So back to Hopkins. Neither education nor engineering are cure-alls, and education is still an important component of success. And I'll give a quick example of how Hopkins worked on road safety education because it actually connects very well to your road safety hub. So when research showed that low-income families in Baltimore didn't have access to safety information or life-saving products, Hopkins actually built a child safety resource center next to the pediatric clinic. And pediatricians referred patients to the center where they had free education and they could buy low-cost products. And like your hub, it was really much more than just a center. It was a place to hang out. And it was a coalition between the key players, which included enforcement and engineering, and in this case, emergency response. And it was as much about bringing these players together as it was about educating people. So here's what the inside of the center originally looked like. And with government funding, the team actually conducted a randomized control style trial that evaluated the impact of the center. And they found that when a visit to the safety center was combined with pediatric counseling about injury prevention, there was a significant impact on home safety behaviors. And since then, the model has actually been replicated in over 30 children's hospitals in the US, and it's expanded in two ways: mobile van use and mobile technology. Because they wanted to reach families who've not been able to or might not want to come to the hospital to visit the safety center. And so they partnered with the local fire department to create a mobile version of the model. And here's a picture from the grand opening in 2004 with the team and the firefighters who worked together to make this happen. And so the center includes a number of interactive educational exhibits that demonstrate home safety hazards and how to prevent them. And it's staffed by a health educator and a firefighter. And importantly, the staff also inspects and installs car seats because, as we were chatting about before, right, we could all probably use some help with that. It's not easy. So an evaluation of the center showed that a mobile safety center actually helps address access and affordability barriers to safety, and it can disseminate injury prevention information and services to families who might not otherwise be reached. And this really shows us the power of listening to the needs of the most vulnerable population and bringing the intervention to them rather than taking them to the intervention. Now, the second area of expansion is in mobile apps to communicate injury prevention messages. And even though the center serves low-income families, they found that the vast majority have smartphones, right? Which is also the case here in Jamaica. Now, Safety in Seconds encourages parents to install car seats correctly. They answer questions and they have immediate tailored feedback, which calls for action. Here's an example of the feedback report. You can see the 4 car seat behaviors with either a check mark indicating that they've done the right thing or an X showing that they could do something better, and they can click and get some more information. So the center, of course, evaluated the intervention, and through over 1,000 families, they saw that the intervention group parents were 2 times more likely to report all 4 of the correct behaviors. And of course, there's still room for improvement, but the app is really effective in communicating car seat information to parents. And the success of this app really speaks to the imminent success of apps like what Julio presented, the IRAP Star Rating for Schools app, which we heard about. We were talking with Rebecca yesterday for UNICEF about how most people in Jamaica, even kids, have smartphones, right? And that's a gateway to effective, simple-to-use tools that can drastically improve their safety. So although we're not focusing exclusively on child passenger safety here in Jamaica, we can draw some conclusions based on Hopkins' years of successfully promoting it. First, the US and Jamaica are different, as I mentioned yesterday. And in the US, my opinion is that we have a patchwork quilt of state laws, which means that our federal road safety laws are really only so strong. But you here have an advantage, that you have the political will and the tools and the know-how. And your law can be created and deployed to your entire country and make drastic change. And the similarity between both here and the US is that you have to start with the most vulnerable because they're the most disproportionately affected, and you are. Intervention opportunities exist in medical care and through community partnerships and technologies. And Lucian said it this morning, right? Local partnerships are key. And we saw that with the Hopkins mobile safety van, which enabled low-income residents to access education and brought together the right stakeholders. And I was so impressed by your own road safety hub, which is really doing much of the same work. And it goes beyond education to coalition building. And that's the thing, we have to make technology available to everyone. And that's why IRAP, for example, is so important. It's free, and it enables the collection of data around schools. And again, education and engineering are not mutually exclusive. Just as you wouldn't only fluoridate water or only teach people to brush their teeth, we have to do both. We're all brought into the idea that similarly, we can't just install sidewalks and zebra crossings or only educate children about road safety. We have to teach the kids to use those sidewalks and those zebra crossings. And we looked at the proceed planning model before, right? But it boils down to the fact that the process by which the center helped increase child restraint use is applicable here. And we have those predisposing, enabling, and reinforcing factors through IRAP and through AMEND and through your laws. And we have to raise awareness, and we have to educate kids and collect data and engineer the safe system approach that will catch the kids who really fall through the cracks of education. And us too, right? Because we're not perfect either. And as we see with the Hopkins work, data collection and monitoring and evaluation are really key. Finally, real success goes viral. And I can say that when I work with your mission at the UN, I see the leadership and I see the fact that other countries in your region and beyond are really looking to Jamaica for the solutions, because your work here extends far beyond your borders. And so finally, I'd like to leave you with a quote from our dean at Hopkins, our former dean, Al Somer, who signed on to our speed vaccine initiative to reduce child road safety, or to reduce child crashes around schools. And I'll leave you with this. The center helped find the cure for child passenger safety. And now we have the cure for child road traffic injuries and deaths here in Jamaica. So together, let's go ahead and administer it. Thank you very much. And I leave you with Andrea's contact information, as I did, of course, present on her behalf. Thanks.
There's a saying, straight from the horse's mouth. So we heard from Andrea, straight from the horse's mouth, someone who has been trained and mentored at Hopkins. Now we understand why it's important for us to have this kind of connection with such a world-famous institution. And we are looking forward to Professor Andrea Gillen coming here. Who knows, Natalie may come back with her and to do the kind of work which is so necessary in Jamaica. And what you saw presented here, Hopkins is doing this kind of research all over the world. If you go on Twitter, there's a feed you can link up with, and you can see the quality of the work and the results. Tremendous things are happening across the world. Not just in road safety, but in many other public health issues. They are making a tremendous difference. Many people hear only about Harvard, but Hopkins is right up there. And Natalie Drayson is right up there. Thank you very much for a wonderful presentation. So we are going to have a discussion now. Abby's outside. Everybody getting excited about the lane. She hasn't left, you know. She's now on radio, on Hotline. Hotline Radio is outside, broadcasting live from this forum, thanks to Mrs. Fletcher. So we're going to sit down here and entertain questions before we go off for lunch, and then we have the post-lunch session. Well, we're going to have a coffee break first, and then Julio is here? Right. He's going to speak after the coffee break, and then another roundtable discussion, and then we're going to have lunch. So let's see how we do this now. We have had a presentation about data. We